Hello everybody, I want to welcome you to my channel. Thank you so much for spending your precious time with me. If you haven't joined the community here yet, please subscribe to this channel. Thank you for doing that. I love to read your comments, so don't forget to leave a comment for under this video, whether you agree, whether you disagree, or any other thing you want to chip in to my experience at the clinical site. So this video is about my ICU clinical experience and mental health clinical experience. Okay, so all my nursing students, gather here and let's have a chat. Okay, so this semester, which ended just yesterday, we went to Ohio. I was part of the Ohio group in the school that I attend, and those of you who have watched the previous videos, I'm in an online BSN program. It's typically 3 years to be in that program, but I transferred in about 65 credits. Those of you who have asked me what school it is, I think I've answered under the comments. I always love to read the comments and I answer it as soon as I see it. So don't forget to ask more questions and your comments, your input, whatever your opinion is. I love to read them. Okay, it gives me joy every day when I read your comments, so please comment. I'll like it, I'll love it, and I will respond to it. So watch out for the responses. I don't know how YouTube does it, but don't forget to also share. Let's share it with other nurses so it can also help them. So the program is an accelerated online program. I couldn't go to in person because I had to work. I had a newborn baby at that time, a very tender baby. So there was no way I could sit in the classroom, even though I had loved to sit in the classroom like I did for my LPN journey, which was 1 year in Knoxville, Tennessee. Yes, shout out to all my Tennessee nurses who knows me personally from the nursing homes and the group homes that we've worked together. Shout out to you all, Lady Eno and all those beautiful nurses in Tennessee. I love you and I miss you all. All right, so let's come back to the reason for this video. It's about my experience in the ICU and the psychiatric unit. We went to Ohio, Lutheran Hospital, and I've forgotten the other one. And I just returned yesterday. I've forgotten the other one. So let's talk about psych first. We went to psych hospital for 3 days, 12 hours, 7 a.m. to 7 p.m. The teacher will send an email and then say that, okay, meet me at the lobby 6:45 thereabout. So psych was a little bit boring. That's the first comment. Psych was very boring. Okay. To me it was boring because there wasn't much hands-on experience. Okay, like the patient to nurse or student nurse encounter was very limited. We went to the unit, 2 units actually. So the first unit, they have people that were in active manic or manic, however way you want to pronounce that, phase of either bipolar or schizophrenia. Yes, so they could be dangerous. You may never know what thought is running through their minds. One of the one scenario that I remembered from there. One of the patients, she was having this what's the name? She was paranoid. She was delusional. Okay, delusional. The one that you think everybody is out there to kill you, and she kept saying that the food is poisoned. She is not going to eat. She wasn't going to eat the lunch because she suspected that it was poison. So watching her experience and her reactions and everything, it brought whatever I read, it came alive. When you go to clinicals, it is book and theory coming alive for you. So yeah, one of my mates kept trying to persuade her, with a positive words that, oh, it's not poisoned. You can, we've checked everything, and then she wouldn't believe it. Still, no matter what you say to this lady, she wasn't taking any of those whatever words we were taking. She wasn't ready to listen to any of that. She was so 100% sure that the food is poison. Somebody's out there to get her. Anyways, and then we had one that had this flat affect and kept pacing back and forth in the hallway, back and forth. I'm like, geez, it was so scary just watching that man. I'm like, geez, you don't know what is running through his mind, and whether he want to punch somebody, whether something is talking to him. Like, he really had some serious scary face. Very, he was very calm, but that flat effect can really make you have some weird thoughts about, what he could do next. But he looked harmless though. And then they had the other floor, the other unit where those patients, they were more stabilized and were ready to go home. Yeah, so they have the very, very active phase of manic or manic. They are actively, trying to do something. They can be aggressive, agitated, all the things that they have the positive symptoms of schizophrenia going, actively going, and then the ones that they've been there for a couple of weeks or days or months and they've been stabilized, and some common drugs that are used over there: lithium for bipolar mood, to stabilize the mood, and one other thing, risperidone, and the other one, haldol. Yes, haloperidol. I'm going to bite my tongue. Oh Jesus, some of these medications are just so hard to pronounce. Okay, so don't get me for it. It's not my mother tongue. Yes, but it was quite interesting. It was a interesting experience. It wasn't kind of fun to me, but it was interesting. That's one thing I can say. It was interesting. The nurses were very friendly because I had a chat with some of my mates who were in Wisconsin, in Maryland, some other places. I remember one of my ladies said the nurses on the unit where they went, they weren't nice, they weren't welcoming. So yeah, one tip I would give to, if you're going for clinicals, be aware, be in the know, know it at first hand that you could you can experience nurses who are not open. They are not willing to let you follow them, learn from them. They are those people that they just don't want you to follow them. They don't want you to see how they do their things. I don't know what's up with that, because one nurse advised us that as we become nurses, we should pay it forward and be always ready to teach new nurses, new nursing students that come into our unit. We should be always ready. And I love to teach. I love to teach. I love to give information that I believe I have that will benefit others. So I surely and definitely will be teaching. I will pay it forward in the near future, in the soon future, if the Lord tarries to come. Yes, because teaching is a passion for me, like to me. So it's not everybody that has that passion. So I cannot fault everybody. But you as a student nurse, be aware and don't take offense. Don't take it personal. Don't let it bother you. Forge ahead. Because there are always people that are like that. You can't change them. It will not change. Okay, so it could be good experience. It could be bad experience. It can be in between. So you just take whatever, that comes your way as an opportunity to learn. And so we're there for 3 days in the psych. Like I said, it was quite, we learned from the nurses. They gave us a lot of information. We asked them questions, they answered, but there wasn't much of interaction with we were part of spiritual therapy. They had different therapies that they do, scheduled therapies, to get these people in a structured and a routine way to destabilize whatever is going on in their minds and heart or emotions. Yes. So I kind of liked those therapies, especially the spirituality therapy, where the clients were expressing whether there is God or there is no God. I thought that it was quite interesting, their mindset about God. Personally, like me, coming from a highly spiritual background, it was quite interesting. And it piqued my interest to maybe do chaplain, take a chaplain course, and maybe go and teach there in the hospital one day in that psych ward and reset their minds to love God. Anyways, that was just by the way. So after the 3 days, we had 1 day break, and then we started the ICU experience in a different hospital, in a different setting. Yeah, so we saw those on ventilators, those who were intubated, those who were on different piggyback drips, titrating back and forth, those who were alert and oriented, those who weren't. Different I got to learn and understand that the ICU is for critically, and they were all on monitors. They were all on hard monitors, being monitored. Some are having VFib, AFib, and then they get them using drugs to come to sinus. Pretty much they try to stabilize them from their critical condition to a more stabilized condition. And one thing, the biggest thing I want you to take from this video, if nothing at all, is that when you go to clinicals, you could be an LPN, okay? You could be a med tech, a CNA, a medical assistant. That's what I'm trying to say. Medical assistant, a pharmacy technician, whatever your background is, especially if you're an LPN. If they've not asked, if the person they pair you with, the nurse they pair you with, if the person has not asked you or where you work, what do you do? What do you work? If they haven't asked you, don't offer to tell them, oh, I'm a nurse, I'm an LPN. Don't say anything. When you do that, these nurses tend to pull back, so pull back information that they could have poured into you. I hope you understand what I'm trying to say. So let them be the boss. Let them, so just be there to learn, okay? Be a teachable student. So put all your LPN experience, knowledge, whatever it is, lay it down for that moment and learn whatever they are giving, even if you know it already. Yes, ma'am, thank you for showing me this. Even if you knew it from your LPN experience, appreciate them for whatever information they are giving you and they are teaching you, okay? But if you tend to talk as if you know it all, they pull back. They tend to they will pull back and watch you do it, okay? Some of them. So beware of that. And so be sure that until they ask you, what do you do? Then you tell them, okay, I'm an LPN, I work in a rehab, or I'm an LPN, I do private duty. But I'm willing to learn, I'll take every knowledge you give me today. Just be humble, and they will pour knowledge, they will pour experience into you. If you go there with that humility in your voice, in your action, your behavior, your body language, everything, if you're able to do that, they will pour more knowledge, more, because our last day in the ICU, the lady the nurse that my instructor paired me with, she's been an ICU nurse for 17 years, okay? 17 years. I cannot compare that to my 13 years as a licensed practical nurse, okay? She has seen it all. Critical condition situations, okay, and how to stabilize these people. So in fact, she poured a lot of great knowledge that I appreciate her for. Nurse Patricia, very sweet lady, very sweet. She's an older nurse. So day one, the first day, the nurse didn't allow me, unless she's changing the brief or the bed linen, she wasn't comfortable letting me do anything. And that was okay by me. I didn't want to pry into her space. Day two, the nurse allowed me do insulin. She was that comfortable with me. And I was grateful to her. Though I do insulins here at my job here, okay? The third day, the nurse let me pass all the medicines. The one with the 17 years of experience. She let me pass all the medication. And I was very glad that I got to do that. Even though I've been passing medicines for 13 years. But I was glad the environment, the settings where I was doing it. I was very glad for that. And I appreciated her. I'm like, thank you for the information. Thank you for explaining this. Thank you for trusting me to give this medicine to your patient. And I realized they all have two patients. And I'm like, okay, I may change my mind from being on the message when I'm done with school to maybe ICU, because I will have only 2 patients to deal with. But then in the ICU, you have to critically think as a nurse, okay? You have to connect all the dots. Someone came in with pancreatitis, okay? What are the labs that this person need the most? You think of the lipase or lipase, the amylase test. You think of your ALT, AST, BUN, creatinine, everything. WBC, platelet, everything. Okay, so your CBC, your BMP, like I said, the amylase and the lipase for pancreas. Okay, you don't just assume anything there. What are the symptoms the person is showing? And when you put the monitors, what are you seeing? You need to be able to connect the dot. So the last patient for the last day, the person had acute pancreatitis. But guess what? The number one thing that will come into your mind when you hear acute pancreatitis or anything pancreatitis is alcohol. but this man didn't have any alcohol. It was gallstones. You understand? So you need to be able to connect everything, read your labs first, you know, and be able to be in communication with the doctor. I really learned a lot in the ICU. You know, our next trip will be pediatrics and maternity. Yes. So overall, I enjoyed my my experience, mostly in the ICU. Yes, mostly in the ICU. So I hope the little advice that I gave is good. Give it a like, share, comment. Let me know what your experience is. Okay, those of you who asked about the school I am attending, because I was in that blue uniform, I already answered it in the comments. Okay, so look in the comments and look in the video description. Click on the links. Follow me. Let's build a community together. I love you guys. Stay blessed.